majority of hereditary breast cancer is likely attributed to mutations or abnormalities in the BRCA1 and BRCA2 genes, we know that having a negative BRCA1 or BRCA2 result does not completely rule out that possibility in an individual or in a family. Two things that I would encourage women to consider after negative results are as follows. The first thing I would encourage you is to take a look at those test results and determine whether or not the most comprehensive level of testing has been done. A few years, about 6 years ago, additional testing became available for BRCA1 and BRCA2 using a different type of technology in the lab that detected additional mutations in those two genes that was not previously available, and therefore those mutations were missed. One thing you want to make sure is, was that testing done for you? And if not, that testing is likely indicated for you at this point. The other thing that I would recommend you meet with a genetics counselor to discuss in more detail is whether or not there may be another hereditary breast cancer syndrome possible in your family. Although hereditary breast and ovarian cancer syndrome is the most common one we think of, and usually the first place we start when there's a family history of breast cancer, there are also many other hereditary breast cancer syndromes that are less common. A genetic counselor can evaluate your family history and determine if testing for those additional syndromes is warranted at this point for you. The other thing that I would certainly recommend that every person consider is whether or not they were the most appropriate candidate in that family to have genetic testing. For genetic testing in general, whenever possible, we like to start testing in an affected family member, an individual who has been diagnosed with that related cancer type. So if you are an unaffected woman, a woman who has never had a cancer diagnosis, I would encourage you to sit down with a genetic counselor and determine, were you the most appropriate candidate in the family to have genetic testing, or perhaps is there another relative that testing would be recommended for that would make your test results potentially more informative in terms of reducing the likelihood of that breast cancer being hereditary. There have been many changes in genetic testing within the last 10 to 15 years, and certainly many changes even within the last 6 months to a year. So if you haven't seen your genetic counselor in 6 months to a year, I would encourage you to reach out to him or her, and I would also encourage you to follow up with your genetic counselor every 6 to 12 months to make sure there aren't any additional updates to recommendations that would alter the recommended testing for you and for your family.
Do you know that not every breast cancer patient needs chemotherapy? Now there's a way to decide if chemotherapy will benefit you based on the unique biology of your tumor. To learn more about the Oncotype DX test and how to discuss it with your doctor, click this button.